Mr Speaker, there were 934 drug-related deaths in Scotland last year. Each one of those deaths is a tragedy, and a preventable one at that. Drug laws are reserved to Westminster. How many more families is the Prime Minister willing to devastate before she will allow Glasgow to get on with the work of building a drug consumption room to save lives?
Prime Minister.
Can I say to the honourable lady that I agree with her that deaths that are due to drugs, each one of these is a tragedy, and I'm sure every member of this House will have known people in their own constituency who have gone through that terrible suffering when they've lost members of their family. There is no legal framework for the provision of drug consumption rooms in the UK, and we have no plans to introduce them. A range of offences is likely to be committed in the operation of drug consumption rooms. Now, it's for local police forces to enforce the law in such circumstances, and we would expect them to do so. But our approach to drugs remains very clear. We must prevent drug use in our communities, support people dependent on drugs through treatment and recovery.
I chose to ask the Prime Minister about drug consumption rooms today because there is a huge issue in Scotland and in Glasgow with drug deaths, 934 last year. Glasgow's got a proposal for a drug consumption room that would reduce harm and save lives. So I wanted to ask the Prime Minister how many people essentially have to die before action will be taken here. The UK Government claims there's no legal framework. I've got a 10-minute rule bill which would give a legal framework, so it's really disappointing to see the UK Government still standing in the face of evidence on this issue.